Hi. So this is a much requested topic. It's called the premenstrual syndrome or PMS. So PMS is any behavioral change or sometimes physical changes, which typically happen around 5 to 10 days before the onset of your periods. It has to happen cyclically, and it usually completely stops once the flow of the period starts, or at least it should stop once the flow is over. So these changes, these behavioral as well as physical changes, affect the quality of life. An extreme form of this particular disorder is known as PMDD or premenstrual dysphoric disorder, and this nearly always requires treatment. So what are the features of PMS? Well, the behavioral changes are very typical and there are varied presentations. Restlessness, irritability, tiredness, depression, easy fatigability, sometimes increased appetite. It can be very touchy and often do things very recklessly during this period of time. And they know that they would not have done these reckless things if they were not going through this PMS. The suffering can be intense because there's a lot of self-guilt, because they know what they are putting through their colleagues or their family through during this period of time. And very often they go into some kind of a social withdrawal because of these features. The physical features of PMS are bloating, typically abdominal bloating, breast tenderness, and swelling in the legs. There could also be acne as well as stomach upsets. Now, if we were to ask most women whether they have some of these symptoms, probably up to 75% of all women will have some of these symptoms, of whom 20 to 30% would have significant PMS, and 5% would be having the significant disorder known as PMDD. So how do we make a diagnosis? Well, we make a diagnosis very easily by keeping a menstrual diary. And if you were to refer to my earlier capsule, we'll have a link somewhere over here and a link down in the description. I would suggest you look at that. But the menstrual diary which I had mentioned was purely in regards to the periods. Well, here in these cases, you will have to add the behavioral changes as well. The reason we would like you to chart it out is because if we chart it out, we'll find out that a few of those patients who think they have PMS actually have some underlying anxiety or depressive disorder. In research, we have something what is known as a COPE chart, and it's essentially a menstrual diary with the behavioral changes added onto it. To diagnose PMS, we would like to first make sure that you do not have any underlying behavioral or anxiety issues which could be the main problem. And this is typically what we don't do. The first thing we patients as well as family do is, as soon as we see some behavioral changes in a woman, we'll label it as PMS. That's what we do not want you to do. We want you to have a check done and confirm that it's actually PMS and not really some underlying disorder which we are missing. It's important to rule out hypo as well as hyperthyroidism because both of them can give similar features. So why do women get PMS? Well, the first thing which everyone talks about is hormone change. Now, that's been adequately tested and found there is actually no hormone change in ladies who have a lot of PMS. But what we do see is there's a lot of difference in the way the lady responds to normal hormones. So it's an abnormal response to normal hormones. So how do we treat PMS? Well, first and foremost, you need to make your menstrual chart, your COPE chart or a menstrual diary, and tabulate neatly all your symptoms on a menstrual calendar. Sometimes just doing this and talking to your doctor helps. And if it doesn't, we'll be maybe doing something. Now, what are the non-medical ways of handling PMS? Well, first is diet and second is exercise. Both of them seem to have some role to play. Vitamin D, calcium, vitamin E, all have been found to have some role to play. and even some types of B-complex tablets. There are a group of drugs which we call as SSRIs or SNRIs, which do quite well to help our ladies with PMS. And they're given short bursts, small amount of drugs at a particular time in your cycle. And it's not like you need to be on drugs all the time. So they do help. For ladies who have a lot of bloating, we have a certain set of oral contraceptive tablets which are available, which specifically decrease the bloating. And in some cases, we would be giving you some anti-anxiety drugs as well. So to summarize, keep a menstrual diary. Tabulate all your behavioral changes in that. See a doctor. If diet, exercise, and those vitamins don't seem to work, then we have oral contraceptive pills, as well as some types of drugs which seem to do very well. Either way, we do not want you to suffer PMS. As usual, please remember these health capsules are only for your information, and we would like you to see a doctor for actual therapy. Please do like, please do comment, and please subscribe. And clicking that notification bell probably helps. All right. So see you soon.